Undeterred by public health measures banning indoor church services, these parishioners gathered this morning as their pastor spoke against COVID restrictions.
Never thought we would come to times like these in Canada.
Some here still believe COVID is a hoax, even after getting it.
There have been a few patients that, even at death's door and on their deathbeds, are in denial.
Dr. Ganesan Abu works at the City of Winkler's Hospital. The facility has had so many COVID patients on ventilators, it's experienced a shortage of oxygen.
There's this idea that we are somehow colluding with a conspiracy that this virus is not real.
The makeup of the community is one that is self-reliant and believe that the less involvement you have with the government, the better off you are.
Manitoba's vaccination rate is almost 65%, but just a quarter of people in Winkler have had a shot. It's even lower in the rural municipality of Stanley at 13%. As the ICU crisis escalates, military lab techs have started their deployment. Ambulance services and the armed forces are continuing to fly critically ill patients out of the province. This doctor is one of a few who called on the government to bring in a stay-at-home order this week. She's critical of how things got to this point.
With the kind of second wave that we had and this delayed onset, as you point out, of the third wave, how could we have delayed action?
Manitoba has ramped up its weekday vaccinations significantly. But now another hurdle. The province won't meet its target of getting first doses into at least 70% of the population by June 9th. Officials say the reason, another shortage of Moderna doses combined with decreased demand. Austin Grabish, CBC News, Winnipeg.